Hello, I'm Dr. Ken Landa. Thanks for watching. Let's talk about isotretinoin or Accutane. This is a drug for severe acne. It was patented in 1969, FDA approved in 1982. It's a synthetic isomer of naturally occurring trans-retinoic acid, which is a metabolite of vitamin A. And it's for severe recalcitrant nodular acne in people over age 12. Now, nodules are more than about 1/4 of an inch in diameter. They're red. Sometimes they have hemorrhage, sometimes they have pus in them. You need a lot of them, not just a few, and they have to be unresponsive to conventional therapy, topical creams or oral antibiotics. And unfortunately, a lot of patients pressure their doctors to write prescriptions when maybe they're not really legitimate candidates. Maybe safer alternatives will do. Most people don't realize that in 2009, the drug company that made Accutane, Roche Laboratories, gigantic drug company, took it off the market. There is no such thing as Accutane anymore. They took it off the market because of a loss of market share, because of generics, because of a decrease in price, and because of an enormous number of lawsuits that they're embroiled in, still ongoing to this day. Now, in less litigious areas of the world, in Canada and in Europe, it's available as Accutane. But in the United States, if you get a prescription for Accutane, no, there is no such thing. You get isotretinoin, you get it as Claravis or as Amnesteem or as Absorica, but you don't get Accutane. It's unavailable. So the medicine is only legitimately prescribed for people who have severe recurrent nodulocystic acne that's recalcitrant to standard therapy. But some people write prescriptions for use of the drug in genital warts, in severe rosacea, or even in an acne-like condition that occurs under the arms or in the groin that we call hidradenitis suppurativa. In the United States, it's only available since 2006 with the iPLEDGE program. Now, the iPLEDGE program is the FDA's attempt to reduce the risks and complications. So it's under what we call a REMS strategy. So that means that basically, if you're the distributor, if you're the pharmacy, if you're the doctor, or if you're the patient, you have to sign up. You have to register. And that means that you have to sign informed consent. So if you're a man, it's a simple informed consent. If you're a woman, that means that if you take the drug, you have to understand that if you may become pregnant, you should be on at least 2 forms of contraception during the entire time, and for a month after you stop taking the drug, you should be on appropriate contraception. Why? Well, because there is a black box warning cautioning that there is a very high probability of fetal abnormalities if the fetus is exposed to any amount of the Accutane during pregnancy. And unfortunately, there's no way for us to determine whether the fetus is affected or not. So if you happen to become pregnant while you're taking the drug, then you better go see the obstetrician right away. Obviously, stop the medicine. And you have to report to both the iPLEDGE people and to the FDA. Well, the reason that there's such a big problem is that vitamin A controls the normal embryologic development of an enormous number of structures. So fetal abnormalities are going to occur in at least 1/3, 1 out of every 3, as a minimum. Neurocognitive defects in a fetus or a child are going to occur in up to 60% of cases. Typically, the IQ is going to be low at less than 85. Going to have abnormalities of the face, the eyes, the ears, the skull, water on the brain, hydrocephalus. Going to have cranial nerve defects, abnormalities of the parathyroid glands, the thymus, going to have cleft palate, even going to have death in some, and premature delivery or spontaneous abortions. Typically, this occurs in women between the ages of 20 and 29. It was happening somewhere between 500 and 1,000 times every year between about 2001 and 2010. More recently, with the iPLEDGE program, it's fallen to about 100 to 300 cases every year, but it still occurs, and it occurs too often. Women are cautioned that if you take the drug, you need 2 forms of contraception. If there's any risk at all that you might become pregnant, tubal sterilization or a vasectomy in the partner or an IUD or combined oral contraception is okay. You could use a transdermal patch or an injection, or you could use the implant or a vaginal ring. Those are the primary methods, and then you need a backup method. You need to use a barrier method, so a condom or a diaphragm, with or without the spermicides. Unacceptable methods would be the mini pill that doesn't have any estrogen, or the microdose of the progestin. You should have availability, just in case, of the morning after pill. And you shouldn't donate blood, man or woman, during the time you're on the pill or for a month afterward, because you don't know who's going to receive the blood. If you happen to be a woman, you need to be on 2 forms of contraception for at least 1 month prior to the time you take the drug. If there's any chance that you might become pregnant, you need 2 pregnancy tests, one at the initial screening and one right before you start taking the medicine, hopefully during the first 5 days of the menses. And if you do that, then you need another pregnancy test every month prior to the time that you receive a prescription. You shouldn't take the medicine, obviously, if you're pregnant, or if you are hypersensitive to it, or if you have a significant liver or kidney abnormality, or if you have hypervitaminosis A, you're popping a lot of vitamin A, or if you have abnormal lipids, especially if you have abnormal triglycerides, sometimes abnormal cholesterol. It's not studied in people less than age 12, and you have to be careful between the ages of 12 and 17 because it interferes with normal bone metabolism. So it's estimated somewhere around 1 in 10 people at 15 years of age are going to have significant decrease in their bone mineral density, and we don't know what that means later on in life. Does that mean that you're going to be at risk for osteoporosis if you take Accutane when you're 15 or 17 or 20 or 25 years of age? Don't know the answer to that. What's the dose? The dose is on the basis of your weight. So it's 0.5 milligram to 1 milligram per kilogram per day. What's that mean? Well, if you're 130 pounds, it means you take about 60 milligrams. It means if you're about 150 pounds, you take about 70 milligrams of the drug. And you probably double it if you have significant acne on the chest or on the back. Now, you take the drug with a full glass of water. You usually split the dose. So if you're taking a significant amount, you take half in the morning and half at night. Now, in other countries, they say, just take the whole thing at one time. You don't share the pills because you don't know who might take the pill and what their risk of pregnancy is. The pill comes available in 10, 20, 30, and 40 milligrams. Other countries have 5 milligrams in addition. You typically be in at a relatively low dose. Typically it's 40 milligrams once a day for the first month. See how you do on the drug. Then you can increase to the appropriate amount later on. Typically 1 course is going to do it. You have complete remission, maybe permanent remission if you take just the 1 course. You can even improve after you stop taking the medicine. So if you need a second course of therapy, as about 10 to 20% of the people do, you don't start it for at least 2 months because there is significant improvement that even occurs after you stop taking the medicine. But unfortunately, as I mentioned, we don't know what the effect on the bone is going to happen to be. So a second course is a little bit riskier than the first, and there is no data on taking a third or even a 4th course. Now, before you take the medicine, you need a blood test. And the blood test probably should be repeated every month while you're taking the medicine. It checks for the liver, it checks for the triglycerides and the cholesterol. And for a woman, obviously, you check for pregnancy. Now, there are some people who say you don't need to get routine screening blood tests, but you really do. That's the requirement. Now, a major issue occurred in 2005. In 2005, the Food and Drug Administration sent an alert to consumers warning about depression and suicidal thoughts associated with taking the isotretinoin or the Accutane, associated with depression and mania and psychosis, associated with suicidal thoughts and behavior, aggressive behavior, violent behavior, sleep disturbances, irritability, anger outbursts, emotional instability. Well, that means that before you even take the drug in the first place, and every month while you're taking the drug, you should be screened, make sure there isn't a significant psychological abnormality or you don't have psychological abnormality in the family. And if something does occur while you're on the therapy, you ought to stop right away and seek help. Well, it's found that Accutane can decrease the metabolism in the orbitofrontal cortex of the frontal lobe. And maybe headaches are a precursor to some of the significant abnormalities, psychological abnormalities associated with taking the drug. Don't know that for sure. But we do know that the drug can decrease the amount of dopamine, decrease the amount of serotonin, and decrease the neurogenesis that occurs in the hippocampus, all of which suggests that there might be a tendency toward depression. Now, dermatologists say, no. Acne is associated with depression. So if we can get rid of the acne, we can get rid of the depression. Psychiatrists say, oh yeah. Say that's not the way we see it. We see the people who take the isotretinoin, they can flare their depression, or they flare their bipolar disorder. So you look at the psychiatric literature, they say, yep, there's association. You look at the dermatology literature, and you say, no, there really isn't. The last study in 2017, looking at 31 studies, what we call a meta-analysis, it happened to be done in China, in Taiwan rather, and they found that no, there's no association. Well, the FDA says actually isotretinoin is the only non-psychiatric drug in the top 10 drugs associated with depression. And they say it's one of the top 10 associated with suicide attempts. So we have a controversial area. We don't really have a definitive answer at the present time. We have two different schools of thought. But we do know that it can increase the pressure inside the brain. It can lead to something called pseudotumor cerebri, which causes a headache or nausea, vomiting, visual disturbances sometimes. And because tetracycline products, including minocycline and doxycycline, might do the same thing, you shouldn't combine the two, so you don't take a tetracycline product with Accutane. Other very common side effects include dry skin, fragile skin, chapped lips, and redness, and dermatitis, and nosebleeds, and hair loss, and some people develop peculiar looking nails, and you can even be sensitive to the sun. Sometimes the skin rashes can be so severe that it might require hospitalization, and about 1 in every 10,000 people taking the drug, taking the Accutane, develop what we call acne fulminans, which is a horrible kind of acne. It's sudden, it's painful, it's ulcerated acne, often associated with fever and joint pain. And we know people who take the drug have sensitive skin, so that for the time you take the medicine and for 6 to 12 months afterward, you shouldn't have any elective surgery or cosmetic surgery. You shouldn't have any waxing or hair removal or tattoos or tattoo removals or dermabrasions or laser therapy. And in a very small number of people, acute pancreatitis develops with or without elevation of the triglycerides. Severe abdominal pain and nausea, vomiting, diarrhea might occur. Rarely this can be fatal, and it can affect hearing, can cause persistent abnormalities in hearing even long after you stop taking the drug. If you develop tinnitus while you're on the drug, you ought to stop. And it can cause some liver toxicity. Now there's another question about inflammatory bowel disease. Well, inflammatory bowel disease is associated with abdominal pain and rectal bleeding, severe diarrhea, Crohn's disease, and ulcerative colitis. Some studies have shown up to a 4-fold increase in the incidence more recently. It shows, well, there's really no increase in incidence. Actually, might even be protective. Don't know what the final answer is going to be, but certainly if there's a history of bowel disorder, it might be erring on the side of caution to suggest this drug isn't for you. Can cause some eye abnormalities, cause corneal opacities, can change your color vision, change the refractive error that you have, change the night vision, cause difficult time putting your contact lenses in. Well, additionally, it can affect the musculoskeletal system. At least 1 in 6 people going to have arthralgias, mild aches and pains, moderate aches and pains in the joints. Back pain is extremely common in adults. Probably about 1/3 of teens going to develop some back pain, going to have delayed healing of fractures if you happen to be taking the drug. We don't know what multiple courses of therapy are going to do as far as the bones are concerned. There's some evidence of cumulative damage, and it would appear that if you happen to be relatively young, say less than 15 or 18 years old, and you haven't attained your full height, well, it might cause premature epiphyseal closure. And we know that it decreases the bone mineral density in at least 1 in 10 people while they're taking it. And it seems that it doesn't get better if you stop the drug and wait for 2 or 3 months and retest. It gets a little bit better if you stop the drug and wait 4 to 11 months and retest, but you don't seem to get back to the full density of the bone. Especially happens if you have osteopenia or osteoporosis to begin with. If you're taking certain kinds of drugs like steroids or anticonvulsants or drugs that interfere with vitamin D metabolism, or if you suffer from anorexia nervosa. And interestingly, it can cause calcification of the wrong things. It causes calcification of the ligaments and the tendons. So you got to be careful about taking the drug. And since it can cause some musculoskeletal problems, it's recommended that you don't engage in high-impact repetitive sport activities. So for instance, football or soccer or basketball while you're taking the drug. And interesting studies more recently have shown that it might affect the libido or might cause erectile dysfunction, abnormalities in sperm production, and might even decrease the testosterone. Well, can you do anything to prevent some of the problems? Yeah, the minor problems, yes, you can use lots of emollients, moisturizers, you can decrease the showering, limit the amount of soap that you use some chapstick or lip balm of some sort, put some moisturizing artificial tears, eye drops in, maybe use some Vaseline in your nose or chew some sugar-free gum to keep your throat moist, to avoid heavy exercise. You have to be a little bit careful because the drug might interact, and you shouldn't take it with vitamin A. Beta-carotene is okay. You shouldn't take it with tetracycline or doxycycline, minocycline, as I mentioned before. St. John's wort can interfere with the estrogen-containing birth control pills, so you shouldn't combine the two. And you shouldn't take Dilantin or steroids while you're taking the medicine. The way the drug works is it seems to work on sebaceous gland function. It decreases sebaceous glands, stops them from working. It alters the keratinization process so you don't clog the pores. It's an anti-inflammatory, and probably most importantly, and just recently discovered, the drug seems to change the microbiome, the bacteria living on the surface of the skin. There are some of the Propriano or Corynebacterium acneus that cause acne and some that don't cause acne. So it switches the kind of bacteria from the acne-causing to the non-acne-causing thing. And by the way, if you take the drug, you should take it with food because that increases the amount that's going to get in the system by about 50%. Most of the drug is bound to albumin. The half-life of the drug is about 90 hours. It can cause some calcification in areas that aren't supposed to be calcified, including the heart and the lungs and the mesentery and even in the stomach. Acne begins to improve within about 7 to 10 days after you start taking the drug. You can have a decrease by about 90% in the activity of the acne while you're taking the drug. About 80% of the people cured, or at least clear, at the end of 8 months. But in some people, within the first month or two, there might be a flare, sometimes severe, but usually not, especially if you begin at a relatively low dose, the 40 milligrams once a day, and then increase it as appropriate later. About 10 to 20% of the people going to need retreatment, especially in people over age 25, but remission can occur for an entire lifetime. Unfortunately, the drug is now being overused. It's easily purchased on the internet. The history is interesting. They originally described it in the 1950s. It was Roche Laboratories in the 60s that tried to use it as a treatment for skin cancer, but it was ineffective. But they found that it seemed to be effective for acne, but it caused birth defects in animals. So this was the era of thalidomide, so they abandoned use of it. But then other investigators, here in the United States actually, were using it for lamellar ichthyosis, a genetic abnormality that seems to cause a lot of dry skin. And they reported that some of the patients who were taking it seemed to clear up of acne. As a matter of fact, of 14 people who had really severe acne, 13 cleared completely and 1 cleared by about 75%. So the FDA approved the drug as a treatment for acne. There was no mention of birth defects on the label at the time it was originally approved in the 80s. It was said that, hey, there are some problems associated with birth defects in animals, but no mention in people. Well, once the drug was approved, and it was taken up with abandon. So within the first 6 months, there were 200,000 prescriptions. In the first 18 months, 400,000 prescriptions for the medication. And remember, only evidence that it caused birth defects in animals, Nobody paid any attention until 9 months after the medicine was on the market, when the birth defects started to appear. And because of an increased number of birth defects, were reported to the FDA and then leaked to the New York Times, that there were, just by 1988, at least 1,000 babies who had significant birth defects, at least 1,000 miscarriages, and somewhere between 5,000 and 7,000 abortions. Then the FDA started to mandate more cautions, and that's where ultimately the iPLEDGE program came in. The iPLEDGE program came in response to requests by a number of organizations, including the American Academy of Pediatrics, that, hey, this drug is not appropriate to be on the market. It's causing too much in the way of damage. Well, the only good news to the story, if there is any good news, is when Accutane was available, it cost $40 a day. So a month worth of Accutane would cost $1,400. Now it's available generically, and you can get a month's supply of the drug with a coupon that you can get at GoodRx or anywhere else. You can get it for about $200, $220 a month. But if you go to CVS with the coupon, you're still going to pay about $380, $390. At Walgreens, it's about $517. That's without insurance coverage, of course. That's just cash with the coupon. So you have the story of Accutane. It's an interesting story, but remember, Accutane has not been on the market since 2009, so all prescriptions are for isotretinoin. Isotretinoin, sold generically by a number of different manufacturers. It's a strong drug. It's good for severe acne, that's recalcitrant acne, for nodular cystic acne. Yes, appropriate, but you do need to be cautious because we have this horrible problem with pregnancy-related defects associated with the drug, and we don't really know what the bone problem associated with the drug is. Is it going to cause osteoporosis later on in life? And then there's a question about the depression and the psychiatric abnormalities. Some people say yes, some people say no. And then we have the inflammatory bowel disease. And inflammatory bowel disease, it seems like that might be less of an issue than once thought. But anyway, proceed with caution. Thanks for watching. If you enjoyed the show, why don't you subscribe, and please tell a friend. I'm Dr. Ken Landau.